I'm Dr. Cecilia Crawford. I'm a registered nurse who's expert in evidence-based practice. I work for Kaiser Permanente, Southern California Regional Nursing Research Program, and Patient Care Services. Since 2014, I have been consulting with Arrowhead Regional Medical Center to help them develop an evidence-based mobility and ambulation program specifically for adults in the intensive care environment. What I'm most interested is hearing your thoughts of how Kaiser Permanente has assisted you in your role, your work, and your world.
I'm a doctor of osteopathic medicine. And the reason that's important is because we use that philosophy, the integration of structure and function, to understand how to better improve health. And one of the things that's so important to improve health is movement and how each part of the body can be moved. We decided that the Move Me program was very, very important. And we wanted to look to those experts in the field. And we've been so lucky to be able to partner with Kaiser Permanente, and they have come over to our hospital and shared their experience with us. They've not only shared their experience with us, they shared their policies and procedures, they shared what they've learned from implementing it at our hospital, and have worked with us very closely to see what we're doing and see how we could move it along a little bit faster, and how we could implement those procedures at our hospital. And we hope that by their continuing tutelage to our hospital, that we could one day obtain the excellence that they've achieved at Kaiser Permanente.
We started the Move Me project in the ICUs, and we wanted to look at our flu patients who were really sick and they developed ARDS. We put them on this special bed called the rotoprone, which flipped the patients on their belly, and it mobilized the secretions, and we were able to oxygenate these patients better, which in turn reduced the ICU length of stay. And we really started thinking about all this mobility, like how great it was for the patients. So we got together with Dr. Crawford from Kaiser and Ms. Fran, and we enlisted the help of Vince, and we looked at the Mahoney and Wells tool for mobility, and we wanted to put it into our electronic medical record, which we did very successfully. And that gave us an opportunity to chart on these patients. So the next step was to educate all the nurses, and there was a little bit of communication issues between physical therapy and nursing. So we got the language tight, and it was working really well. And now the nurses are able to assess the patients, give them a mobility score, and with the help of the tool, guide the nurses into progressing the patients through their mobility. And we got some really good outcomes.
I had the fortune of being chosen by Francis Dyckman to work on this Move Me initiative. My role in all of this was to analyze and implement a tailored version of Kaiser's mobility documentation into my facility's current EHR. This also included showcasing how the documentation worked to stakeholders, to teach staff how to use the documentation, and to display captured data into dashboards in a meaningful way. Kaiser's support of Move Me was instrumental in our successful efforts to roll out this initiative. Cecil Crawford, our mentor, guided us along the way to help us overcome expected and unexpected obstacles and challenges. I believe if all collaborative staff fully commit to the Move Me initiative, then I envision a paradigm shift and a change in the hospital's cultural view of patients' overall recovery. No pun intended, this project moved me into a state of intense creativity and research. I employed everything my current EHR had to offer with the help of my outside-the-box approach to make this the most effective and accepted tool. Without a doubt, it is a grinding process, but at the end, it was well worth the effort. For a majority involved, including the end users, praised me for what I helped create.
Today, the hat that I'm wearing is that of the Safe Patient Handling Coordinator, and I'd like to discuss this marriage between Safe Patient Handling and Move Me. Move Me aims at mobilizing patients, where Safe Patient Handling has the goal of reducing caregiver injuries. There are two key differences between the two programs, Move Me and Safe Patient Handling. Move Me is a voluntary hospital initiative aimed at improving patient outcomes by mobilizing patients. Safe Patient Handling, on the other hand, is a regulatory requirement aimed at reducing caregiver injuries associated with mobilizing patients. So you can see that there is a unique bond that links the two. And when we do this, we create synergy by incorporating components into the nursing care plan that addresses the goals of both programs.
A team of us at Arrowhead has had the opportunity to collaborate with Kaiser, creating MoveMe, a program to promote early mobility in the hospital setting. We have rolled out our program in the ICU and look forward to watching it grow hospital-wide. Kaiser's support of MoveMe has been positive and motivating. We've had the ability to collaborate with such a large institution who experience similar challenges and barriers despite their great resources and research experts. Discussing solutions and ideas based on Kaiser's experiences has been one of our greatest motivators to keep the program going throughout its ups and downs. As a therapist involved in the program, I have assisted in making a mobility tool for the nurses to document that includes language consistent with PT vocabulary. By documenting using similar terms, it will help as the program continues to grow for nurses, physicians, and therapists to understand the mobility score and how it pertains to the patient. Patients benefit greatly from mobility for many reasons, such as cardiovascular and integumentary benefits. Patient outcomes at discharge can vary depending on the amount of mobility the patient has had during their hospital stay. For that reason, MoveMe promotes a culture of mobility to directly benefit our patients. MoveMe is also a great step in allowing our therapists to focus on patients who need aggressive therapy for discharge and allows nurses to prepare our patients for therapy via early mobility when they aren't quite ready for us.
We've instituted the MoveMe program. We have done a great deal of things. We've changed the way the nurses look at the patients themselves. We got the nurses to understand, and also the other support people, and also the physicians as well, to understand how important movement is to the person. So the nurses have been trained on how to document what's been going on, and then also once they document a certain level of mobility, what steps they need to take in order to get them to the next step. And then we follow that progress. And we have seen that the nurses have been well trained on how to document and have been trained how to get the person moving as well. And we've seen that there's been a change in decreasing the length of stay that we've seen in the ICU. So it has an impact not just on the patient care, but on the philosophy and the culture of the way the nurses take care of the patients, and the way the physicians take care of the patients, and the way the patients understand that movement has a great deal of interaction, a great deal of promoting their own health. And so that's why we think the MoveMe program is very important, and how we will continue to move it here. And then once this program is successful, hopefully we'll be able to work with Kaiser, and so that it could be spread out to many other facilities.